Hi there, I'm Hayley, and I work on the project management team at Sano. Sano combines genetic testing, recruitment, and long-term engagement in one platform, accelerating enrollment and simplifying operations for precision medicine teams, driving breakthroughs for patients. Today, I'll walk us through how we supported engagement, screening, and retention for an Alpha-1 antitrypsin deficiency study. Sano worked with an industry-leading sponsor to rapidly deliver genetically qualified volunteers for precision medicine clinical study in Alpha-1 Antitrypsin Deficiency. AATD is a genetic disorder that can lead to lung and liver disease. People with AATD have a deficiency of the Alpha-1 antitrypsin, AAT, protein, which is made in the liver and normally protects the lungs from damage. Without enough of this protein, the lungs can become vulnerable to inflammation and damage, leading to conditions such as emphysema and chronic obstructive pulmonary disease, or COPD. In some cases, AATD can also affect the liver, causing liver disease. AATD can be diagnosed via a blood test, and because it's an inherited condition, testing can identify people who carry the genetic mutation that causes AATD. AATD affects around 1 in every 1,500 to 3,500 individuals with European heritage across the globe. It is among the top 3 life-threatening rare diseases that can impact individuals of European origin, along with cystic fibrosis and Down syndrome. AATD affects men and women equally, and it is not a sex-linked heritable condition. The condition is frequently either misdiagnosed or underdiagnosed. Reports suggest that less than 10% of individuals with the condition have received a proper diagnosis. Often, patients who exhibit AATD symptoms are instead diagnosed with COPD or asthma, and it can be 5 to 8 years on average before an accurate diagnosis is made. AATD prevalence varies by population and is more common in isolated or confined populations with less genetic diversity. It is most prevalent in individuals of Northern European and Spanish or Portuguese descent. AATD can present as liver issues in newborns, and lung disease symptoms can start appearing as early as age 20. In smokers, diagnosis often happens in individuals in their 30s, whereas non-smokers typically receive a diagnosis in their 40s. Sano's challenge in this instance was to assist the sponsor and contract research organization, or CRO, in identifying volunteers who have a rare genetic variant and match a complex health and medical pre-screen criteria. The primary genetic variant desired by our client is present in only 1 in 3,000 Europeans and is even rarer in non-Europeans. The secondary genetic variant of interest is present in approximately 1 in 25 Europeans. Participants were required to have pre-existing genetic data and to live close to a single site, which obviously narrowed the participant pool substantially. The trial was looking for those with the genetic variant of interest who were healthy, but the variant increases the odds of having a long list of conditions. So we'll start with an overview of Sano's general approach and then chat through a few details about how we supported this AATD study. Sano sets up a separate patient finding protocol that maps out the best way to find difficult to reach patients faster. Then we easily screen, consent, and onboard participants for studies. This includes non-invasive at-home saliva DNA testing for patients. We then offer a virtual waiting room. This is a dynamic space designed to provide engaging, meaningful, and convenient patient-to-researcher interactions. The VWR allows you to segment your patients into specific cohorts for customized communications. You can run your research studies along the virtual waiting room and recruit from the cohorts as needed. And then We enable you to engage patients between study stages and site visits and tap into the virtual waiting room to find additional participants at any time. Of course, our offerings are flexible, and for this particular AATD study, Sano utilized its existing database and extensive partner network of genetically sequenced individuals to deliver genetically qualified referrals who matched a complex pre-screening criteria. Prospective participants were pre-screened based upon genetic, geographical, health, and medical data, enabling Sano to provide higher value referrals, reduce site burden, reduce screening costs, and provide a better patient experience. Sano provided an end-to-end integrated patient experience, including genetic pre-screening, pre-screening survey, and direct-to-patient communications. Our client was pleased with the speed and quality of our participant referrals. Sano successfully delivered 90% of the referral target within the first 4 weeks of the agreed upon 4-month recruitment period. And overall, we referred 58 genetically suitable volunteers. We continue to support these types of rare conditions because we know the challenge of enrolling studies with small patient populations. We remain dedicated to accelerating the world's transition to precision medicine, including in the rare disease space. For more information, please visit www.sanogenetics.com or email hello@sanogenetics.com.